So now we're going to take a look at some general features of a typical long bone. And these general features are what we call macrostructures. Macrostructures meaning these are large structures, structures you can see without the aid of a microscope. So the first thing we want to point out when we look at a long bone is this long middle area right here. This is called the shaft or the diaphysis. At the ends of a typical long bone are these little knobby ends, which we call the epiphyses. Epiphyses is plural, epiphysis is singular. At the ends of the epiphyses, you will see something called articular cartilage. Artic, A-R-T-I-C, means joint. So articular cartilage is cartilage that you find at the joints, where two bones come together. The next structure on a typical long bone is something called the epiphyseal plate. Now in this diagram you can't really see the epiphyseal plate, and we'll talk more about the epiphyseal plate when we talk about endochondral ossification, but you can barely see a line running across right here. This is the epiphyseal plate, and down here, if I were to take a cross section of this bone and show you the internal part of this bone, you would see an epiphyseal plate right about in this area. The next structure is called the medullary cavity. The medullary cavity is this hollow chamber that runs the length of the diaphysis. Within the medullary cavity is where you'll find a substance called red bone marrow. Next is the periosteum. Peri, P-E-R-I, means around or to surround. Osti means bone. Periosteum is the connective tissue that surrounds the outer part of the bone, right? Periosteum, connective tissue that surrounds the outer part of the bone. And then the last structure is called the endosteum. End means inside. Oste means bone. So the endosteum is the inner membrane, right? It's the inner membrane that lines the medullary cavity. Okay, it's the inner membrane that lines the medullary cavity. Okay, so again, all these structures are what we call macrostructures, structures you can see without the aid of a microscope.